Cancer has its own side effects, and the treatments will induce other side effects, sometimes to decrease the side effects of the cancer. It's a complex area, and all that is done in this area is called supportive care. So we have a society called MASS, the Multinational Association for Supportive Care in Cancer, and in different countries, other societies that put together those that try to alleviate the problems related to the cancer and to the cancer treatment. A key factor, in my opinion at least, and I think in the opinion of quite a few of my colleagues, is that if we have produced guidelines based on the evidence that have been produced in the past few years in different areas, these should be followed. And regrettably, we have evidence in most areas that guidelines are not followed, and therefore patients are not getting the ideal treatment that they should get and that they deserve, clearly. Moving forwards, there are many areas of supportive care that still need a considerable amount of work. And we are developing, for example, in the area of nausea and vomiting, questions about what is the nausea that patients have. We have basically controlled vomiting. It's a rare event nowadays, but patients complain of nausea. We yet have to understand what this really means, so specific protocols are needed. Another factor in nausea and vomiting control is that while we all agree that for highly metagenic chemotherapy, where patients will always have nausea and vomiting, there's no discussion. We should apply the guideline treatments. In those areas where the risk is not as big, there's a big debate on how much should be or should not be given, and can we define which patients are at the high risk compared to those at the lower risk in the same medium risk category. So there's an effort going on. There's a prospective study that is going to start very soon to see if some of the factors that we have defined in the past, like the protection related to being male compared to females, have more nausea and vomiting, the regrettable fact that alcohol consumption decreases the risk of nausea and vomiting. If putting all of that together can indicate who is at a higher risk and deserves the best possible combination treatment. And the same is true for all others of supportive care. We have not found the right answers everywhere. We have found good answers, but we can improve. Of course, guidelines based on evidence coming from studies are limited. The reality of the clinic is that we have many situations where we don't have specific studies. So what is usually done is that we rely on the guidelines for what is available there, and then on the experience of those of our colleagues who have already seen these situations. In big centers, for example, this can be often during a multidisciplinary team or so-called tumor board, where someone will know, oh, actually, I had this type of situation, I did this and I did that. In other settings, we rely on the fact that we have networks of colleagues and we call upon them and find someone who can help us.